Hi everyone, welcome to this global hangout conversations on coronavirus. Today we are connecting 5 frontline workers from 5 continents in this global response. So joining me today from the United States is Justine Bender.
Here, my name is Justine Bender. I work at several COVID designated ICUs and IMCs in the Baltimore, Maryland area. Thank you for having me on.
In Brazil, we're joined by Dr. Rogério Hammerschmidt.
Hello, hi, I'm from Brazil. I'm from Curitiba, a city in the south of Brazil, and I work in a university in a huge hospital that is referenced here in our state for coronavirus.
In South Africa, Dr. David Skinner joins us.
Hi everyone, I'm a consultant intensivist and surgeon, and I'm working on the east coast of South Africa in a city called Durban. I currently run a private ICU with approximately 30 beds at the moment.
In the UK, we're joined by Dr. Richard Breeze.
Good afternoon, home. I'm Richard Breeze. I'm a consultant intensive care doctor in London, and my hospital was unfortunate enough to be one of the first hit hard by this pandemic.
And in India, Dr. Samir Gupta.
Hi, my name is Dr. Samir Gupta. I'm an interventional cardiologist at a Metro Group of Hospitals. I'm the cath lab director of the hospital, and I'm also a member of the COVID task force in the hospital. I practice in New Delhi, India, which is the capital city.
Well, thank you all so much for joining us amid everything else, of course, that you're dealing with right now. Let's just get a global picture to start with. I want to quickly go round. Tell me, what are you most concerned about in your country right now, starting in the US with you, Justine?
Now are mainly aimed at preparing. We're watching all of our colleagues, we're watching all of you in different countries being hit and hit hard. And we're nervous and we're scared. We also have an immense amount of pride to be right here with you. The general morale right now is just trying to hold our panic down, take advice from our colleagues overseas, and kind of come together. We are starting to get hit hard, especially in areas like New York and Washington. The cases of COVID are starting to trickle in here in Maryland as well, and faster. So generally, we're all just trying to come together and face it, because we can't really stop right now, and we're seeing that with you all. So we thank you so much for everything that you're going through ahead of us right now.
All right, if someone else wants to jump in, what are you most worried about right now?
If I may, in London, we're predominantly worried about 2 things. The first is, do we have sufficient capacity to manage the patients that need our help? And enormous efforts have been made in the last couple of weeks to build giant new facilities. And I hope that we do, and I hope the capacity will be sufficient. The other concern we have is, are we treating these patients with the best possible medicine that we have? We don't have much in the way of therapy. Most of our treatment is supportive, and we're still learning about, with this new pathogen, about the best way of managing patients that are suffering.
Let's go to India.
Yeah, so in my country, I'm concerned about the case numbers as they're coming up. Slowly and steadily the numbers are going up. We are currently on day 9 of lockdown. And everybody has supported this lockdown really well. We've taken it in our stride. The healthcare facilities are currently open, but we're a very populous country and a very dense country. So obviously there's this sense of concern that where will we peak? Are we going to peak, or when are we going to flatten? When those numbers come, those numbers are going to be huge if it is to happen. And I cross my fingers they're not, and we are currently preparing for it. But that is definitely a concern, and I know this is a concern for many people for India.
And David, to you in South Africa.
Well, I'm quite worried about, in South Africa, we're quite a split society. We've got quite a large difference between, we have a large population of indigent people who are living sort of reliant on the government healthcare system, and then we also have a private healthcare system, which is obviously a lot better resourced. I also have a huge HIV prevalence in South Africa, as you know, and we don't actually know how the virus is going to interact with people who are immune suppressed. A lot of our patients are, or a lot of the people are living in townships, so very close contact. Social distancing is not possible for these people. A lot of people live sort of hand to mouth, and the lockdown, we're currently on day 8 of lockdown, is very difficult for the police and the army to enforce at the moment, because people have to leave and get food, and there's still, social distancing is difficult. And once the virus does take hold, we're only at about 1,500 cases at the moment with only 5 deaths. But once it starts getting into our townships and our more densely populated areas, I'm incredibly worried about what's going to happen with our resources, which are not as good as those in the sort of more developed countries.
So concerns on every level, whether that's societal or within the hospitals themselves. People are really eager to understand what it looks like in hospitals right now, what you're facing. We had a question that came in on Twitter, @CaseOfVon wants to know, perhaps to you, Dr. Richard, what does your daily grind look like on the front line? I mean, just walk us through what we're facing right now.
It's a good question. It's changed enormously in what has unbelievably only been the last 2 or 3 weeks. The daily grind is completely different. We ramped up our capacity in my unit by a factor of 300%, and we've been running. We have to rebuild rotors, staffing, sourcing consumables, sourcing new kit, completely changing everything about our life and making difficult decisions about the patients that we can help. At the moment, we have had just about sufficient capacity. I've transferred 26 patients on ventilators with COVID in full PPE to surrounding hospitals in the last 2 weeks in order to free up space in mine. Those hospitals are now filling up, and so transfers in the future are likely to go to the Nightingale sort of super facility in a conference centre. So this movement is a big part of what we're having to do to share the load as this patchy pandemic spreads. It doesn't spread evenly. But in the unit, of course, it's enormously arduous. Everyone is in PPE the whole time. The nursing staff are having their entire world upside down. They ran a tight ship before, and that ship is now 3 times the size, with different people doing different things, and roles are blurred. And it's enormously difficult, but they've all stepped up incredibly well. Our team have just been fantastic. We run a flat hierarchy. Everyone is empowered to join in their team ethic, and I think it's been in many ways an inspirational performance from the health service, and I'm incredibly proud to be part of it. But we are probably still in fairly early days, and thus far we've put processes in place to cope with what's coming through the door, and I just hope it's adequate.
You talk about nurses, Justine, I want to ask you, as somebody who's on the sharp end in that way, what does your daily work feel like? How has it intensified in recent weeks?
So I couldn't agree more that when you say roles are blurred, they truly are. Everyone is kind of all hands on deck, and I can't imagine what you're going through right now. We're still in very, very early phases, and the stress is high. But it is an attitude of the earlier days, you would kind of walk into a clean utility room and there'd be a nurse or a doctor or RT in there or a tech crying. But now it's we keep going. You just kind of have to keep going because there isn't really any time to stop. On my ICUs, we have very sick patients, obviously, like everybody else, but we have a lower load. We're on my IMCs. I'm very proud of the staff there because we have opened up floors that we haven't used in years. We have moved COVID patients down to these floors so they can get more specialized direct care. I'm worried about the staffing numbers, but right now it is just we have to keep going.
Dr. David, by most calculations, South Africa is around 2 to 3 weeks behind the UK, for example, right now. So when you listen to Dr. Richard, your international colleague, I mean, what goes through your mind? Are you nervous?
Yes, that's the short answer. We're sort of seeing what's been happening in Italy and Spain, and we're seeing the ramp up in the UK. We're kind of living in this sort of waiting for the tidal wave to hit scenario, and I totally agree with Justine saying, you know, we're so nervous. We have this almost pre-trauma stress where we're sort of we know what's coming. We're prepared as best as we possibly can for it, and we even know that's underprepared, most likely. I'm doing constant training with my nurses, trying to reassure them. There's a lot of panic. There's a lot of misinformation out there. People are acting irrationally. We're trying to calm people down to say, we're trying as best as we can to prepare. You know, we've got the same issues as everyone else because we're so far behind in terms of the actual curve, in terms of where we are. We are struggling to get our PPEs stocks. We try to ramp up sort of about 3-4 weeks ago, but we're finding that wherever we turn, people were saying, sorry, we're sold out. We've already gone across to, Europe or the States or China. So we are worried. Like I said, we're seeing this tidal wave heading towards us, and there's really nothing much we can do.
And Dr. Samir there in India, I know you're in charge of a lot of preparation and training as well of teams. I mean, what are your staff saying to you about this as we watch this kind of tidal wave? Are they scared?
They're scared. They're definitely scared. They're concerned. They'll come up to you and say, "Hey, doc, will I get this?" The nurses are scared. The doctors are. There's a lot of confusion, a lot of emotions. Like my colleague from South Africa said, a lot of information, a lot of misinformation. WhatsApp, Dr. Google, whatever you call it. So we're trying to dissipate some of that. We're doing a lot of training, and the thing is, the government is also coming out with guidelines, and they're also doing their part. I think everybody in India recognizes that if this goes up, then this has the potential to be out of control, because just like South Africa, we are also a very densely populated country. There are a lot of people who are from lower class. They don't have place for social distancing and stuff like that. So the nurses, and we're trying to reassure them, not just by education, but also by by leadership, by telling them it's going to be okay. This is what you want to do. You signed up for healthcare, and the government is also, the Prime Minister Modi, he keeps coming on television and he keeps re-emphasizing that you guys are the soldiers, healthcare providers are the soldiers. You guys are going to take us through. And we from our end, from the hospital standpoint, not only are we doing a lot of training, but we're also, for example, in India, hydroxychloroquine was approved for prophylaxis. So then all of a sudden, everybody wanted hydroxychloroquine, and it was difficult to procure. So we were able to procure that, give it to our staff, give them the PPE, tell them that we are with you in this. You're not alone in this.
And guys,
so it's definitely a concern.
Talk to me a little bit about the patients, because I think when this started, there was a lot of confusion about really what COVID presented in people, whether it was just older people. But of course, I'm sure now from the people that you've treated, some patients must stick out in your mind. Anyone who comes to mind that you think of? Justine, Richard?
Yeah, I certainly have. Our observation is that this is not just an old person's disease. This, very sadly, most of the patients on my unit are actually quite young, a lot of them younger than me, and quite a few of them died, almost universally with comorbidity. And so what this virus attacks weaknesses. And so diabetes, hypertension, and raised BMI are very, very strong risk factors. And that unholy trinity seems to be a very prevalent feature in our patients, who are not all old. And sadly, the young people are not doing particularly better. Age isn't the main determinant. It's actually comorbidity, and it's terribly sad. We've had some heartbreaking stories. We've had some notable successes, but we feel that we're still not quite sure what's best to do for these patients. They present with a very strange range of pathologies, and the lung damage that this virus causes is unlike anything else we've seen before. And so we're learning on the go how to look after them, and I don't think we have all the answers yet.
Yeah, and you're pointing to the fact that the novel nature of this virus, and we did have another question on Twitter from @PinnedShankar, who says, when you're working in a COVID environment, how do you feel? And what is that frustration like when someone dies despite your best efforts? Perhaps someone has experience or wants to share something on that.
Well, in my case, it was heartbreaking. It's never nice to tell parents that they're losing it. You have lost a child.
Okay, I also would like to tell something. May I tell something about our country? About our country here in Brazil. We are a continental country. We are a very, very big country, and so we have many differences between our cities. And I think we are just like South Africa. We are 2 or 3 weeks before the peak of this virus. We are 2 or 3 weeks before Italy, Spain, and now United States. And so, as we got it, it's good we are before, because we could be prepared here and we could prepare our hospitals. Now we are in the phase that we are putting more beds in our hospitals. In my hospital here, we have 600 beds that are only the totality of the hospital is made today for this virus. But what stresses us most now is the fact that we don't know what will happen. We don't know exactly. We are just based on the numbers of Italy, Spain, the United States, and now England. And we are not really quite sure what will happen in our country. And we have this so large country where we put up the number of the beds, but will they be enough to our patients? We don't know, and we don't know if all our efforts will be enough. And that's what stresses us. We are trying to tell the population that they have to be home, they have to be social distancing, but at the same time there is this fight about the economic part, the thing that what we should do, we should suppress only, or we should mitigate at the moment. What is the moment of mitigation? What is the moment we can tell the population that we are safe, that we have intensive care and units enough for these people? And so the medical team here is very stressed. The population is very stressed. We see every day on the media all these numbers, mainly in Europe and China before, and that stresses us because it's a new disease and we don't know what will happen. So we are doing our best. Our Ministry of Health here in Brazil, with all our social differences, is doing their best in putting beds, putting campaign hospitals to do the best for our population. But what most is stressful to us is to deal with the unknown. Deal with the unknown is what stresses us, and our daily routine here is totally changed. We only think of that, of course. We almost gave up of every other medicine diseases today, and everybody studying that. And our day starts at 6:30, 7 o'clock, just studying coronavirus and seeing if there is a vaccine or a medication or the chloroquine or something that can help us to diminish our stress and to give the population a better answer of what will happen. And that's what I think nobody knows.
Right. I can see a lot of people nodding, and the kind of word that keeps coming back is stress on every single level. And I wonder about, how you deal with that in your personal life as well. That was another question that came in on Twitter, actually. At Grow Politics has asked, how has this affected your personal life? I mean, Justine, you're coming home to a young daughter, right?
Yes. I get emotional every time I think about it, because it is scary, and I keep saying scary and terrified. And you can tell me all day that, oh, it does not affect young children like that. But as you were just saying, we don't know. And as healthcare providers, we like to know everything. Especially in our critically ill patients, we can't just look at numbers and fix a patient. We'd like to know the background, the history. Where have other patients been with this? And so this being so unknown is what is so terrifying about it. We're learning as we go, but we're learning together. We're using, at least as far as I know, and the people I've worked with, we're using online forums and groups on Facebook and video chats with colleagues all over the world to see how they're treating these patients, and not just treating them, but the type of patients they're seeing, what demographics are they coming from, what worked for them, how they're, even as far as how are they acting when they go home? Are they social distancing from their families? Have they seen their family members they've been in touch with getting sick? So it is scary, and that is the first word that for sure comes to mind. Yes, me and my daughter, we will hug and kiss again very soon, but in order to do that, we have to stay away from each other right now. She knows there's a lot of bad germs out there.
Where are you staying then, Justine?
I'm still staying at my home. We have talked about when we stay away from each other, me and her. We've talked to her about what bad germs are, or she's 4, so you can't really expect her to understand much. But the other day I was joking with her, we were doing a homeschooling session, and I did a joke, like an air high five, and she's like, "Mommy," and she started backing away from me. So that made me laugh. But me and my husband have had several conversations about when we start to get hit in the next few weeks, the tidal wave you were talking about, David. When we start getting hit, where I'll be staying, and home will not be it.
Yeah, I'm doing the exact same thing. I'm married with 2 small boys. I've got a 2.5-year-old and a 6-month-old boy. My mom-in-law stays with me. She's got chronic lung disease. She's 70 years old.
Oh.
I try and isolate myself as much as I can from them, but as soon as I'm getting positive patients that are coming in, I'm fortunate enough to have a small flat that I can go to, but I'm not going to see my family, which I'm not happy about. That could potentially go on for months. My wife is an anaesthetist as well, so she's also potentially on the front line. We're trying to keep her away from ICUs and just trying to do the emergency work, but of course, as it becomes endemic, she is going to get exposed. So we've had to have some difficult conversations. I'm a big proponent for talking about death and dying. I always have been. People I've spoken to, I've said, get your living wills in order, get your proxies in order, make sure your wills are up to date, you know, doing all the horrible things that a 30 and 40-year-old person normally doesn't do, you know, and who's going to look after my sons if, you know, both my wife and I die from this, you know, because there's a very real chance being on the front line, tubing all the patients that we might get it. Yeah, there's a lot of thoughts that run through your head, and it's as intensivists often we're very obsessive about these things, and it's hard to turn off when you go home. You know, it's all you.
Yes, of course. I have also 3 kids, and it's tough to get home and I can't kiss or I can't hug them, and that's the most difficult part. I think all over the world we are feeling that, and here in Brazil it's not different. So that is a shame, but that will pass, I think.
Yes.
And I want to ask, you know, despite all of this, you're doing it because there has to be some hope. Any stories that keep you going? Stories of hope.
If I can share, so a couple stories come into my mind, but I have one in particular that will stay with me, I think, way long past this. We, on the ICU, I had a COVID rule out, and the rule out is the test has not come back yet. And he was an 89-year-old male, the sweetest. I love my elderly patients. And it was his birthday that day, actually. So we got a bunch of the staff outside of the room, and I went in and I was just bringing him dinner, and you know, he's in there watching the news, and of course the news is on about COVID. He knows why he's there. But we were able to sing him happy birthday, and of course he appreciated that, and we had a little laugh. And then what was fantastic was not more than 30 minutes later, his test results came back and they were negative. So we were, it was not a dry eye, at least for me and him around the room. So that was, that'll stay with me for quite some time.
I am so glad to hear that. That is a fantastic story. And
I have another along similar lines. We about a week ago, one of our nurses in our resus department, in the emergency department, became suddenly very ill, and she came in, and our emergency intubation team went down, and we had to intubate her in resus in her normal working environment. She came up to the intensive care unit. We transferred her to a neighboring hospital, and 48 hours later she came back. She was better, and she's gone home. And the morale boost to the staff in our enormously dangerous resus environment, where all of the patients coming in, seeing one of their own get ill and get better, was an enormous boon for absolutely everybody. And of course, most people do get better. That's what you have to remember.
Right, guys, well, we're going to have to wrap up the conversation there for today. Thank you so much for sharing your insights. Of course, thank you for sharing and continuing to do your work, of course, as well, and talking to us today. Everybody who's watching at home, stay safe. Everyone stay at home if you can, to protect people like this working on the front line, and do stay connected, of course. We're back on Monday. See you then. Bye for now. Bye, everyone.